So here we have test question. Pause the video, take a few minutes, read this test, guess which answer is the correct, and after, let's discuss this test step by step. So it's 27-year-old woman. Her major complaints are fatigue, weakness, and lightheadedness. On physical examination, she appears pale. Her complaints and pallor combined looks like a typical anemic presentation. After this, we look at blood analysis, and we always begin with hemoglobin. Her hemoglobin is 70, which is low. Decrease in hemoglobin we call anemia. Anemia explains her fatigue and pallor, and we know that anemia classified based on severity and the size of red blood cells. To determine severity of anemia, we have to know two numbers. It's 110 and 80. Also, in this case, it's a woman, and the lower limit of normal of hemoglobin in women is 120. So, from 120 to 110 is mild anemia, from 110 to 80 moderate, and lower than 80 is severe. In this case, hemoglobin is 70, so it's severe anemia. The type of anemia we determine by the size of red blood cells, and to determine the size of red blood cells, we look at MCV. In case of MCV, we have to know two numbers. It's 100 and 80. Everything above 100 is macrocytic, between 100 and 80 normocytic, and lower than 80 is microcytic. In this case, MCV is 72, which is microcytic anemia. So, in this case, patient has severe microcytic anemia. Everything else, as we see, is normal. We know that all microcytic anemia develop due to decrease in production of hemoglobin, and recall that hemoglobin consists of heme and globin, and heme consists of iron and protoporphyrin. And we have four types of microcytic anemia: iron deficiency anemia and anemia of chronic disease cause iron deficiency. Sideroblastic anemia affects formation of protoporphyrin, and thalassemia affects formation of globin. The most common cause of microcytic anemia is by far iron deficiency anemia, and the second most common cause is anemia of chronic disease. So we have to exclude them first. They all cause decrease in serum iron, but iron deficiency anemia is characterized by low level of ferritin and high transferrin level. In contrast to this, anemia of chronic disease is characterized by high level of ferritin and low level of transferrin. Also, for examination purposes, you have to know that out of these three markers, in case of iron deficiency, ferritin decrease first. After this, transferrin increase, and only after this, serum iron decrease. So we diagnose iron deficiency anemia primarily based on ferritin level, and we treat until normalization of ferritin. So the correct answer in this case is iron studies. Coombs test will be the correct option in case of autoimmune hemolytic anemia. Vitamin B12 level is the correct option in case of macrocytic anemia, as well as folate. Both vitamin B12 and folate deficiency anemia are macrocytic. In this case, MCV is 72. So we can exclude them both even based on complete blood count. And bone marrow aspiration will be the correct choice in case of acute leukemia, for example, where we have to find more than 20% of blood cells.